Foodborne diseases are those diseases or the illness which are caused by eating the contaminated food, either by the viruses, bacteria, worms, or other organisms. Foodborne infections, they are caused due to the entrance of the pathogenic organism, microorganism contaminating the food into the body, and the reaction of body tissues to their presence. And these entrance of the viruses, bacteria, or microorganism is through that food which is contaminated by them. Foodborne infections, they have the long incubation period, and they are usually characterized by the fever in the initial stage of this infection. So bacterial foodborne infections could be E. coli infection, shigellosis, cholera, then dysentery. These can be due to the bacterial foodborne infections. Mycotoxic foodborne infections may be due to the fungal infections which are on the food. Then viral foodborne infections includes hepatitis A, poliovirus. They are also due to the infected food intake which are infected by these viruses. So the symptoms mainly due to the foodborne diseases are seen after a few hours or days, because of their long incubation period, and the symptoms appeared are diarrhea, fever, abdominal cramps, then nausea, vomiting, or mucopurulent and bloody diarrhea, and also the continuous vomiting, headache, muscle pain, myalgia are also seen in these patients. And these foodborne diseases leads to the depletion in the fluid level or in the body of a human who is infected by these foodborne diseases. An infection usually appears after few days or as they have a long incubation period. So the sources of infection could be are mostly the food which is contaminated, or sometimes the direct animal meat or poultry meat can be the source in which that particular animal or animal is infected. Other sources for these contaminated foodborne infections can be undercooked meat, unpasteurized milk, contaminated water, feces of infected people are the ones. So the prevention for these foodborne diseases are clean and sanitize all the important and domestic fruits, vegetables, and keep the utensils also free from microbes, or clean utensils, and also prepare the meal, a well cooked meal. Do not eat uncooked or undercooked meats, and also do not expose the food to the outer environment. Cover them properly. Proper handling and preparation of food storage. Do not leave eggs, meats, poultry, seafood, or milk for extended periods. Then keep hot food warm and cold food cool, and store them at their appropriate temperature. And on the other side, the waterborne diseases, these are the diseases are caused by the ingestion of water contaminated by human or animal excrement, which contain the pathogenic microorganisms. The disease they include are cholera, typhoid, amoebic dysentery, bacillary dysentery, or other diarrheal diseases. So the agents which causes disease through waterborne could be bacterial, protozoan, or viral. So bacteria may be E. coli, cholera, Vibrio cholera, Salmonella typhi, and viral can be viral gastroenteritis. Can be the disease, and protozoan diseases like giardiasis can be involved. Polio is also the other disease which are can be due to the waterborne diseases. And the symptoms of these diseases may involve fatigue, fever, abdominal pain, nausea, diarrhea, dysentery, weight loss, excessive loss of the fluid from the body, jaundice, and itching. And hepatitis A is also one of the infection can be caused due to these waterborne diseases. And and hepatitis A is its risk increases due to this unsafe water drinking or use of the water, or poor sanitation and poor hygiene. Polio is also one of the disease which enters polio in which the polio virus enters the water through the feces of the infected individuals, and that contaminated water, if consumed by the healthy person, then it may cause polio. It may also spread by the food or food borne disease, contaminated also can be there. Now, the storage of water at the proper sanitation, with proper sanitation, and also the avoid the clogging of water at a place, store in the tanks, and proper cleaning and timely cleaning of the water should be there, and covered tanks should be built for the water storage at the large level. Otherwise, the waterborne diseases can be an outbreak in the community.